changed the title from the rather boring one that I had before. So what I'm going to talk to you about tonight, you all know I'm here, but I'm going to talk to you about equine flu. It's only a little virus, but it does have a worldwide impact, and that, unfortunately, for some people in this room tonight includes them near. Can you hear me? Out of charge. Okay. Well, I'll try and get away with that. So yeah, I just really wanted to talk to you about the virus, the disease, the way it transmits, and really some of the things that we understand about it. So some of the last slides that I've got will be some information we've got on this very latest virus that we've isolated from horses quite close to here. So this is what we're dealing with. You'll just work on the screen. Anyway, there we go. So this obviously is not a real flu virus. This is a cartoon, and for a bit. Okay.
No, it's 10.
Right. Anyway, flu viruses affect horses. They affect humans, they affect pigs, they affect birds, they kill poultry on occasions, and this is kind of what we're dealing with. The important part of this virus there, you see the letters HA and NA. Well, the HA is really important because that's the part of the virus that attaches to the horse's respiratory tract and allows it to invade. Okay, and I'll come back to this later on and talk about that in a little bit more detail. Okay. So what does equine influenza do? Well, in what we call fully susceptible animals, or sometimes we call them naive, so these are animals that have never met the infection and have not been vaccinated, then it causes quite severe respiratory disease, and that's particularly characterised by this frequent, harsh, hacking, dry cough. So a real hack of a cough. It causes fever, so the animals are pyrexic, they have a raised temperature. That makes them feel quite dull, put them off their food, and they can really feel quite sick. So you get this inappetence and depression as well. And then in the later stages, because, and I'll show you some pictures in a minute, basically the lining of their trachea, their windpipe, basically is destroyed, and that allows bacteria to go in, and they suffer this secondary bacterial infection. It can develop into pneumonia, and that's often when we see actually this snotty nasal discharge that comes several days into the disease. And the really characteristic thing about flu, unlike any other horse disease that we see, is the speed with which it can go around the group of horses. And people that suffered the outbreak around here have really noted that themselves. They've seen that in 20 horses, within only a few days, have all gone down with this disease. So it does spread very, very rapidly. The other thing is it can spread over quite a long distance. So just because you've got your horse in a stable and it's some distance away on the same yard, that's not going to unfortunately protect it. This infection can travel over possibly up to a kilometre away, particularly for horses producing a lot of virus. When he's coughing, he's got his head out the box and there's a wind carrying that virus a long distance. So, what about the history of flu? Well, it used to be known as the distemper of horses, and it's been described as long ago as the 18th century. And these descriptions really do describe influenza as clinically indistinguishable from the disease that we know today. And therefore, in these reports, it's easily recognised historically. But as you will see, the virus that we're dealing with today, we can only trace back to about 1963. So it's really quite a recent phenomenon, but there's obviously been a number of these flu viruses come in and affected horses over the centuries. So the first flu virus that was recognised was in the heyday of virology in 1956, and that was isolated from horses in Prague. And this is how we name flu viruses. It's an A-type virus. It's the first one to be recovered from horses, so it's A1, and then it's Prague, the place where it's isolated, and 56 is the year that it's isolated. So when you see these names through the talk, that's what you recognise: the place name and the year. Okay. But interestingly, we haven't encountered this virus, which is what we call an H7N7 virus, so named because of those two outer proteins. We haven't encountered that since 1980. So it looks like that has been eradicated from horses around the world. Okay, so these are the pretty little pictures. I'm not sure whether you can see this, but this is what we call, this is a scanning electron micrograph, so a very detailed photograph of a healthy, what we call ciliated epithelium. So essentially the lining of the trachea has a carpet, and that helps clear any dirt, debris, bacteria that the horse encounters. Particularly important, obviously, if you're exercising horses and they're taking dirty air and that sort of thing. But if you go and infect a horse with influenza, then only 3 days later, you start to see that that nice carpet of cilia starts to get disrupted. And that's what this virus does. It damages this, and that obviously affects the way that the horse can clear the debris from its airway. Here you see, actually, that's a bacteria that's now able to come in, is not being cleared, and causes damage. And only a few days later, the whole of that sort of base of the carpet has been exposed, and that leaves the horse susceptible to the secondary infection. So that's what this virus is doing inside the horse, and when that happens, all the nerve endings are exposed, and that's why this horses cough. That's the only way they can clear the debris. They're very sensitive in that area. So what about the history of the sort of modern equine flu, the one that we recognise today? Well, as I've said, that dates back to about 1963, and it was first recognised in racehorses in Miami, in Florida. And it's not exactly known where that came from, but we've got no record that this virus existed before then. The most likely thing is that actually it transferred from birds into horses, and we've been living with this infection ever since. And as this map here shows, that basically tracks the movement of this virus across the American continent over a couple of years, and that was with the movement of racehorses. Often they'll go down into Florida to overwinter, and then they'll start moving around, and they were taking this infection with them. And then it did spread, and this led to a sort of pandemic of horse flu over the next few years. So what's the relevance of this infection to the horse world? Well, it occurs with the movement and mixing of horses, and that's probably why we see it most commonly in the summer, because that's when everybody wants to do things with their horses, take them to shows, events, and this sort of thing. And that's perfect for this virus, because it has opportunity, obviously, to jump from an infected horse to a non-infected horse, and then continue its journey on. It's airborne. These animals cough, and when they do that, they produce a lot of virus, and it goes a long distance. It also is not just a local problem here in Towcester, it's also an international problem. And we've seen this virus jump around the world. When we move our horses around the world, we do have a habit, unfortunately, of taking the infections with them, causing these problems. And you're probably aware that Australia had not seen equine influenza before 2007, when it imported some Japanese stallions for their breeding season. It managed to bring in flew into their quarantine station. They didn't manage to contain it, and then it got out, caused very big problems in the two states of New South Wales and Queensland. So, you know, this is a truly international virus. Okay, very famous quote there, famous to me anyway, because I know the guy who made it, and it's absolutely spot on. Influenza doesn't kill horses, but it does kill horse events, and that's why it's important. It's not a highly fatal disease, it spreads rapidly, move with horses around these events. And occasionally it can make the headlines, and these are just some old headlines that were in the racing industry when influenza struck a few years ago and brought racing to a standstill. And that obviously is when it's highest profile, has a big financial impact, and it's done that in several countries at different times. It's happened in Britain, it's happened in Ireland, it's happened in France, it's happened in the Philippines, it's happened in Australia, it's happened in South Africa, it's happened in Hong Kong. So flu, as I say, is a significant problem. Okay, so what about understanding how this virus behaves in horse and how does it spread from horse to horse? So what we have here is a very simple schematic where if you imagine you have a healthy but susceptible horse. So this is our horse who hasn't been vaccinated. He's not met the virus before in his life, but he's about to get an infection. So it's the new arrival on the yard, and he's brought the virus in with him, and our healthy susceptible horse then acquires that infection. We then go through what we call the incubation period, and that's really the time from the infection going into the time that the first clinical signs appear. And those signs often are, the first one might well be a fever. So if you're regularly taking the horse's temperatures, then the first thing you'll notice that this animal is starting to spike a temperature. It may well then go off its food, and then later it will start perhaps with a nasal discharge and then start coughing, and that could take several days. It will also go through what we call a latent period, and that's the time from infection to the time that the horse itself becomes infectious. And that again is quite a short period, only several days. And then it goes into this infectious period. And obviously this is really important because this is the time that this infection has an opportunity to jump from the infected horse into other horses and keep its journey going through the population. Often the signs will last longer than the horse is actually infectious for, but in susceptible horses we know that that infectious period can be about 10 days. Doesn't sound very long, but that's enough to infect a lot of other animals depending on the population that it's in. And that period there is really important if you're thinking about how are we going to control this by stopping the movement of horses mixing and taking this virus with them. So you can imagine that on the last day here that the horse is infectious, we then infect another one, then you've got the whole cycle to go through. So really you've got to be thinking about several weeks that we keep horses closed down and not moving if they're going to be non-infectious. Now all these periods, certainly the infectious period, does tend to shorten when we have vaccinated animals. So vaccinated animals can get infected, can become infectious, and can spread the virus, but they're much less efficient at that than they are if they haven't been vaccinated. Okay. So as I've said, during those signs, the period of the signs, that's when we're going to see the fever, the cough, the nasal discharge, the horse off its food. And then, once the animal comes out of its infectious period, because its immunity is going up, mounting antibodies against it, that's fighting the infection as we would, then the horse then becomes immune again. Okay? And a really important thing to remember with flu, unlike other diseases like herpes or strangles or EVA, is that there is no known carrier state for equine flu. So what that means is once a horse has gone through its infectious period and become immune, it's not then a source of virus until it becomes susceptible again and maybe meets a different virus later on. So what this infection really relies on is being able to spread from horse to horse during the time that that animal is infectious. So it needs a chain of transmission. And that's what we see here. So during that period that the horse is infectious, it meets another animal, and this has a chance to propagate. We see this whole thing continuing on. So that brings in a concept that we call in science the basic reproduction number. Sounds very complicated. Well, all that means is the number of horses that an infectious horse will infect with this virus if it's never met the virus before. And basically, if that number is less than 1, then effectively that chain of transmission cannot continue. It has to die out after several transmissions. But if it's greater than 1, and a lot greater than 1, then what we see is this idea of a propagating epidemic. And influenza in naive horses has been calculated to have an R0 value of about 10. And that's plenty enough to see large outbreaks of influenza occurring, particularly in large populations of susceptible horses, such as happened in Australia. Many tens of thousands of horses were affected with the virus when that happened. So just keep that idea in our head about R0. So what happens with vaccination? Well, in the ideal world, what we would want to do by vaccinating a horse is take a healthy, susceptible animal here, vaccinate it, and then effectively bypass all of this bit and make it healthy and immune. So that's what we're doing in concept when we're vaccinating the horse. Okay? So that it doesn't show signs, it isn't infectious, and we can do whatever we like with it safely, knowing that it's not going to infect other horses if it should meet the virus. And what vaccination effectively does is take that magic number of R naught and make it below 1. So it actually reduces the chance that we get a big outbreak. It also increases the likelihood that if a virus goes into a population, that it will just die out, because it hasn't got enough susceptible animals to keep going. And that brings in the concept of, if you like, a herd immunity. If we vaccinate enough animals in a population, it doesn't have to be all of them, then we know that that virus is not going to spread and become a problem. And that's why vaccinating horses that are active and mixing and going and potentially meeting this virus is really, really good, because that's what actually protects all of us. Unfortunately, none of that is guaranteed, because vaccines get out of date, not everybody vaccinates, not all horses respond the same, so real life is never quite as pretty as we like to paint it. Now, what we've done at the Animal Health Trust over many years, and even before I was there, we've got involved with manufacturers in developing vaccines and testing them and making sure that they do work. And we do this work in horses because it's relevant to horses, obviously. We use Welsh mountain ponies, and they are good because they're not routinely vaccinated, and touch wood, they don't go down with flu very often. So we know that most years we can get hold of Welsh mountain ponies that are totally susceptible to flu. We can vaccinate them and we can see if those vaccines work. And various methods have been used in order to do this. Now you'd think that the classic way is you infect one horse and then you mix it and then the infection will spread. Well, okay, yeah, that does work, but it doesn't always work. Instilling the virus up the nose, intranasal instillation. Again, that surprisingly doesn't always work. So the method that we've been tending to use for many years now is this idea of taking the virus, nebulizing it into an aerosol, and then getting the horse to breathe that in. And that's what you see on that end picture there. It's basically horse breathing in the virus, which it would do naturally to speed the infection. And that is a really good way of reproducing influenza. And what we've shown over quite a number of experiments is that the level of protection that we can measure in the blood of an animal by vaccinating it is what we call directly correlated to the amount of protection that we'll get. So the more antibody in the blood, the better the protection that we will see. And you probably can't read this very well, but what we've basically shown is that not all of these experimental methods require the same level of protection. And I'm going to cut a very long story short and get to the end here. But basically, by using quite a high dose of virus in a nebulized form that the horse breathes in, it shows us that we require actually quite a high level of antibody in order to protect that animal. So we need quite good vaccines to be able to do that. And that's really what obviously we're trying to achieve when these vaccines come out, to give horses the best level of protection that we can. And although you probably can't see it unless you're in the front there, but there is quite a marked difference there, depending which route and which dose of virus that we use as to the level of protection that we need. And this will become relevant in a minute when we look at field outbreaks and we think, how much protection do they have from their vaccination? So what about flu in vaccinated horses? It would be really nice to be able to stand here and say that over 20 years at the Animal Health Trust, we've never had a problem with the flu vaccine breaking down, not working, and that if you vaccinate your horse, I can guarantee for the rest of his life he's going to be fine. I can't stand here and say that, because it's absolutely not true. We know that we see flu in vaccinated horses, and there are a number of reasons for that. Although it is true today, and it's been true all along, that most flu that we diagnose every single year, we don't diagnose that much, we tend to see the tip of the iceberg, a lot going on beneath it that we never pick up, but the vast majority majority of those do occur in non-vaccinated horses. So that one of the messages of tonight really is, if you're doing things with your horses and they're at risk of contracting this infection, do think about getting them vaccinated, because it does work, and most times we don't detect it in vaccinated horses. But occasionally those vaccines do fail, and they suffer what we call vaccine breakdown, and that basically is just defined by the fact that in vaccinated horses that we would expect to be protected, we do see signs of influenza, and we're able to demonstrate that despite that vaccination they have been infected, and they are infectious to other animals. And I guess most commonly over the years we've seen that in young thoroughbred racehorses, and that's probably not a surprise. These are young animals, they do mix around the country, they can take their infections with them, and they're athletes, and anything that knocks an athlete off its stride tends to get the trainers and vets by exercise. We do tend to get the samples from them, and then we do tend to diagnose flu. So a lot of what we've done in terms of work has been done on the young racehorse. Okay. So what about the signs that I described in the naive horse, those quite overt signs that you would easily diagnose as flu? What about in vaccinated horses? Well, those signs tend to be much milder. You may not see every horse affected, but you will tend to see, what we do tend to see, is a rapidly spreading nasal discharge. Some horses coughing, some horses with fever, but not all of them. What we tend to find is the animals with the lowest level of immunity are the sickest horses in that population. They produce the most virus, and they're probably the ones responsible for doing the most of the spread. Okay? So, yes, very much the better protected a horse is from vaccination, the less likely it is to go down in signs, and the less likely it is to be infectious to other horses. So that brings us into this concept of, well, do I need to vaccinate my horse every year? Well, it's probably best to, because what you're doing by doing that is maintaining that level of protection, giving the horse the best opportunity of being protected against this infection. Okay, I won't dwell very long on this, but the message here is that not all flu viruses in horses are the same. And this is some work that we did over a number of years, and basically what it shows is that you may well be aware that we talk about high path and low path avian flu, and we get very excited by highly pathogenic avian flu that kills flocks of poultry, and that's the one that can jump into man and we need to get really worried. But the low path we don't worry about so much. And we don't talk in those terms in terms of horse flu. But we've got some data here that kind of shows that maybe we should, because not all these viruses are the same. And I won't dwell on this slide, but basically what this shows is that with 4 different viruses, 2 isolated in 93, 1 isolated in 89 that caused a large epidemic, some of you may well remember that, and then one that we isolated from a lot of racehorses in 2003 when the vaccines seemingly weren't working very well, that basically we couldn't detect the difference in the amount of virus that was shed when a horse was infected with those viruses. So the same amount of virus was coming out of those horses, but we saw a very marked difference in the number of days that those animals suffered fever. And that really is a measure of how sick the horse is. And these two, what we would call almost epidemic type viruses, the 03 and the 89, they produce fever for quite a few days more than these milder viruses that we just happened to isolate from racehorses in 1993. And then finally, and probably more importantly, with the number of days that these viruses caused horses to cough. And 2003 was actually a better virus for causing horses to cough than even the 89 virus. On average, about 10 days of coughing would be induced by this virus, compared to only about 3 days for the 1993. And when you're a flu virus, being able to cause coughing is really important, because that's what gets the virus out of the animal and into the environment and gives it a chance to obviously transmit. So not all flu viruses are the same, and it's only when we start to do these sort of experiments that we can start to understand, well, that was a hot virus, that was highly efficient, and that's one we need to worry about and So, I'm going to now talk about flu surveillance. I don't know whether you're aware, but in humans, there's surveillance of flu going on all the time. A network of laboratories around the world monitoring the flu viruses that are causing problems. They're having the southern hemisphere, the northern hemisphere, all over the world. We've got them here in the UK. And they're really important because what they're doing is monitoring what the virus is that need to go into the vaccines. And you'll know probably that human vaccines get updated virtually every single year. We certainly don't have that issue here with horses. And so what we try and do similarly, and it's a bit harder because there aren't as many labs, we don't get as many submissions, but we try and monitor what's going on with these viruses over time and also over space. And in time we're talking about years, and in space we're talking about the entire world. There's only a small network of labs, one in Newmarket, there's one in Dublin, there's one in Germany, there's one in Lexington in Kentucky. And between those labs we're just trying to get one set up in China and also in India as well. And so what the point of this work really is to try and keep tabs on this virus and to keep comparing it with what's in our vaccines. And inevitably, if you don't update the vaccine, then those strains in that vaccine get further and further away from the viruses that are now causing the problem. What we really worry about is if we get too far away in terms of the difference in the viruses, that can really cause problems. The vaccine will stop working. Okay. And we have over the years done quite a number of investigations when those vaccines look like they're no longer working. And so I mentioned 1989. That was the first time that we really recognised that the vaccine at that time was no longer working. Compulsory vaccination by the racing industry only came in 1981, following the outbreak in 1979. And by 1989, only 8 years later, those strains, which were 79 strains in the vaccine, were seemingly no longer working and needed to update them. There was a little bit of investigation done in 1993, and that really identified on the same day two different horses that had come in through the sales from different routes, the presence of two different viruses that were really quite different. And that alerted the world to the fact that actually this virus has been evolving and diverging, and we may well have different viruses circulating in the world. We looked at, again, another limited outbreak in Newmarket in 1995, and I'll present some data from that in a minute. Similarly, in 1998, present some data from that in a minute. And then we had the large outbreak in 2003. And that's probably the biggest one that I've seen in vaccinated horses since I've been at Animal Health Trust. And there were quite a number of factors that all came together as sort of a perfect storm for why those vaccines work. So, just to orientate you here, I'm sorry you probably can't see this very well, but essentially what we've got here is some data from 25 horses that were in a training yard in Newmarket that we investigated in 1995. The first column here is the identity of the horses. Then we've got a measure there, which is the level of antibody that those horses had at the time that the infection was diagnosed. We've then got whether or not we diagnosed flu in those horses, and those animals are shaded in blue. And then we've got a dotted line there, which I've now just highlighted in red, and that's a magic number, which is this level of antibody above which we seem to get protection. So what you can see there, in summary, is that basically any animal that had an antibody level above 150, the unit's not important, but it's the same as what I mentioned before, didn't get influenza. And that number is pretty close to the highest number that I showed you when we talked about the amount of antibody that an animal needed to be protected when we aerosolized the virus and infected it. And so that's about the same number. So that most severe challenge that we, due to our experimental codes, is telling us that's what we need when we look at the field. Everything below that, apart from 2, went down with flu. And the reason that was that basically these animals hadn't been vaccinated within the last 6 months, and their antibody was starting to go down for most of them. What we then come to is 3 years later, different yard in Newmarket. This time you've got data from 52 horses, same presentation, antibody levels starting with the lowest at the top, highest at the bottom, whether or not they got infected with flu, shaded in blue, and the same threshold, which is put in up there, 150. And hopefully what you can see now is, whereas we've got no blue below the line here, we have got plenty of blue here below the line. And that's telling us that even though we've got high antibody, it's not protecting our horses against flu on this occasion. And the reason for that was that by now, the vaccines were out of date. This was an American, what we call an American lineage virus, coming in against horses that had only seen a different type of virus, and therefore the amount of antibody didn't matter because they were seeing a different virus. And this was telling us that the vaccines were no longer up to date and needed to be updated. Okay. So, what about the activities that we do at the Animal Health Trust? We run a diagnostic service, and that's how we were able to diagnose influenza through my practice. They sent us samples, they asked us to test for various things, and it was the flu that came up positive. We run what we call a Sentinel Practice Initiative, and that's funded by the Horse Race Betting Board. So again, the link back to racing. They are funding ongoing work with flu. And that essentially is practices such as Towcester Veterinary Centre sign up to be part of a group of practices that will be the eyes and ears for flu, if you like. If they suspect flu, they can send us samples. We won't charge them to do those tests. We can't cover their costs, but we can cover the laboratory tests specifically for flu. And what we try and do there is encourage people to send us samples if they think they've got flu. And again, that works really well. And the practices, if they sign up to that, will get regular updates and newsletters from our researchers telling them what's going on. And I'll present some data later on that's pretty hot off the press in terms of virus that we've got here. We also have I know Pfizer is kind of sponsoring this, but I do need to mention it. There is another company, and they're sponsoring a different system called ResPcheck. And that, again, is a way of somebody paying for the laboratory testing. And in that scheme, we actually test against a range of different organisms, not just flu, but it does include flu. And that, again, is designed to encourage compliance, getting tests done that may not otherwise be done, and for us to get viruses that we wouldn't otherwise get to see. And then finally, there is a text alert system, which again is sponsored by a different company, and that's where vets sign up to receive text alerts in the event that we diagnose flu through our laboratories. We tell the company that we diagnosed it, and they send out a very simple text alert to vets around the country saying, flu diagnosed in Northamptonshire, and that alerts vets to be on the lookout then. If they know that there's flu virus about, they can be on the lookout for it, and hopefully it helps everybody once you know there's something's happened. And they do have another system linked to that, where practices can get text alerts put out to their clients to remind them about flu and vaccination and all this sort of thing. And it's all about information and dissemination of that information. Okay, so what does flu surveillance actually involve? Well, we conduct laboratory diagnosis, and as I've said, we rely on vets going out there. They see the animals, they do the work, they make a clinical diagnosis, or they make a clinical assessment of an animal, and they may think, oh, this might be flu, it might be flu, it might be strangles, and then they submit those samples to us, and we conduct the tests, and then we tell them if it's this, that, or the other. And that's what we call passive surveillance. We are very reliant on others sending us samples. We're not too, there's nothing we can do about that. We rely on vets going out there and doing that. But we also have this sentinel practice scheme, so we have a subsidised scheme to encourage vets to go and do it. And once we've diagnosed an outbreak, that's when we become a little bit more proactive. We get in touch with vets like here, get a good history, try to find out where this may have come from, find out about the vaccination status being used at the time in the horses, if any, and then we may well get involved in trying to work out why, if those animals are vaccinated, that they're not being protected by the vaccines. We do get involved in that. And then finally, the trust, as I've said, is one of a small network of what we call OIE reference laboratories. So they're kind of world experts who specialise in investigating and characterising these viruses. And we receive these viruses from all around the world. And basically what will happen is the scientists will characterise, I'll go into that in a little bit more detail, but essentially they try and understand what this virus is and where does it fit in the family tree of viruses that we're seeing around the world. And also, very importantly, we try and collate and disseminate information on all of this to raise awareness. That brings us back to one of the earliest slides, this flu virus, the cartoon, the HA, the outer protein. That's really important. So this is a protein spike sitting outside the virus. This is what attaches to the respiratory tract, or in the nasal mucosa. And if you're able to produce antibodies against this part of the virus, then you can block its attachment and you can stop infection from occurring. But because this is what we call an RNA virus, it's just a single strand of genetic material, it does have a habit of spontaneously mutating. And what then happens is that leads to changes in the HA protein, and those changes build up quite quickly, relatively, compared to other organisms. And over time, that starts to differ away from what's in the vaccine, away from viruses that used to cause infection, and the horse's immune system kind of forgets or can't recognise what this new virus looks like. And that's when we get vaccine breakdown and we get new infections occurring, even though the animal has either been vaccinated or met the virus before. And therefore, what we see is this evolution of this virus over time. By taking snapshots of the virus over time, we start to be able to build up this, what we call phylogenetic, but actually it's just a family tree of viruses. And once we get that virus, and often we have to grow it in eggs in order to get it in sufficient number to be able to do anything with it, but once we have it, and we take that bit of the RNA, we can unravel what the genetic code is, the same way that the human genome is being unraveled, so we do it with two viruses. And with fancy bits of technology that they have in the lab, they're able to come up with a sequence of amino acids or protein or nucleotides as they are here. And that gives us this genetic code. And we can monitor how that changes over time. And what we're then able to do is take that code, line them all up, and see how similar they are. Okay? So in this here, we've got a whole host of viruses all lined up here. Where we see letters, all in blocks, that's where we see that there are differences away from what we call our reference strain. We start with one strain and we compare everything back to that. And what you can start to see here, unsurprisingly, is we're seeing clusters of viruses that look very similar, some that look different. And these are the differences that go into being able to form this family tree. This is one form of a family tree, and it does look like a tree. It starts down here at the bottom. That's good old Miami 63, and then it spreads up, branches out, and we see this sort of divergent evolution of the virus. But we can represent that in a slightly different way, and this, whilst it isn't all the flu viruses that we've got, it does trace back all the way to 1963. See what happened there? Okay. So, whilst you can't see it very well, this sort of small cluster of viruses, this is the sort of main trunk of the tree before it starts diverging. So it's what we call the pre-divergent viruses, really in the 1960s and 1970s. where we saw this. Then things started to get a little bit more exciting, and it may well have been around the time that we did start using vaccines a little bit more. And what we saw was that that main trunk started diverging into two branches. And these were called lineages, one called the Eurasian and one called the American. And they were so called because that's where these viruses were evolving. One was on the American continent, and one was on the European continent. And obviously they were evolving separately, and they were tending to cross over. But what did happen in the 1990s was that one of these American lineage viruses did come over to Europe with a horse. We don't know which one, we don't know when. But it was obviously better at doing the spreading than our European ones. And over a number of years, we saw our Eurasian virus starting to disappear and then be dominated by this virus, which we later called the Florida sublineage clade 2. And that's the latest branch of an American virus that had grown out of the pre-diversion. And just to contrast that, I'll go into this in a little bit more detail. Obviously, where we've got clade 1, clade 2, we've obviously got clade 1 as well. And that really is still the dominant virus that's on the continent of America. North and South America tend to suffer from clade 1, elsewhere clade 2. Okay, so just a quick sort of timeline through viruses. Miami 63, that was the first emergence that we had as the sort of the matriarch of the family, the one that started the family tree. Okay, then in 1979, we've got a new market here, there were various versions. That's when racing was stopped because of equine flu. So many horses were coughing, Royal Ascot was affected, and then following an inquiry they brought in the Jockey Club rules, and that's what most people are still living with today. That came in 1981. Okay. Sussex 89 was when the first major vaccine breakdown occurred, and that really was the first time that vaccine manufacturers did periodically have to update their vaccines. We then got these two strains that occurred on the same day in one yard in Newmarket in 1993, the outbreak in 2003, and then this one here in horses in Richmond in 2007. This one's important because that's the virus that's been really well studied and is the one that we've been recommending to the manufacturers to put into their vaccines for quite a number of years now. And as you will see, we're not quite there yet, but this is the one that we want to see in the vaccines, because this is the one that's going to be most closely related to what we're seeing in the country at the moment. And just to highlight that this isn't just a European and American problem, it also causes problems elsewhere in Europe, and here we have Mongolia and India as well. They have a problem with very similar viruses that we do. We don't totally understand how that transmission has happened, but they are very similar viruses. Okay, then coming down the clade 1 line, we had a significant outbreak in South Africa in 2003 that was imported into South Africa. Again, a failure of quarantine and biosecurity meant it got out, caused a significant outbreak, only the second one they'd seen. And when they looked at that virus, that looked significant. It had changed significantly from the strains that we had in the vaccines. Ibaraki-07, that's a Japanese virus. That was the virus that was the source of the Australian outbreak, which we know as Sydney 07. That's where it first came in. Now, they went about it in different ways. Australia, flu in horses is an exotic disease. They don't want it there, and they managed to eradicate it within about 4 months of it arriving. Of course, a lot of disruption, but they did manage to eradicate it. Okay. Lincolnshire 07. You may recall that I said that we only really see clade 2 viruses in Europe. Well, this was one example of a flu virus that we saw in a horse imported from Spain into Lincolnshire. This was a clade 1 virus. A bit of an unusual one. It didn't seem to go anywhere, and we never isolated that again. Until in 2009, and I'll show you a map in a minute, but that virus came in halfway through the year, and predominated for the rest of that year. It's the only virus that we saw, and it's the one that we expected to be the one that took over, and that we would now be talking about clade-borne viruses. But as you will see, that wasn't actually the case, much to our surprise. So this came in and didn't take over. And this one is interesting, Divide 12. This again, clade-borne virus. This actually was imported to Dubai. It was picked up in a horse in quarantine, and that animal had originated from Uruguay in South America. So this horse from Uruguay transported this virus all the way across the world into Dubai. They detected it, sent it to us, and we were able to tell them what it was. So back in 2009, we started that year rather predictably, in that we had some clade 2 viruses following on from what we'd seen in 2008 and 2007. And we just expect, well, here we go, this will be the clade 2 virus that we see. But to our surprise, later on in the year and then for the rest of that year, all we were picking up were these clade 1 viruses, and you can see them all clustering together there in the family tree. But actually, those are the last clade 1s that we've seen in the UK ever since. Because in 2010, all we saw were clade 2s, and they were clearly closely related to what we'd seen in 2009 early on. Obviously, they were still circulating, but for whatever reason, we just hadn't been detecting them. But they really did come back in 2010. And so it continues in 2011, 2012, these are the 2011 outbreaks. We've basically just seen a continuation of those viruses continuing to circulate, particularly around this time of year, and so it continues. Okay, same in 2012. Again, by looking at the family tree, you can see that they're obviously derived from what we saw the year before. Okay. So that brings us round really to what's been going on in around this area. We have now managed to isolate the virus, and the lab, not me personally, they've started to characterise it and compare it to what we've seen before. So just to orientate in. Where the blue line is, you see these letters here. Those are the sort of parts of the protein that's the haemagglutinin on the outside. And that's for the Richmond 07. So that's the virus that we know a lot about. We know how it behaves in horses. It's the strain that we recommend goes into the vaccines. And we know what the genetic code of that is. And what we basically do is line everything else up against it. And in yellow is the Northamptonshire strain that we isolated only a little while ago. So what I've then done is just highlight in yellow again these 4 viruses, all from 2012, 2 in Worcestershire, 1 in Oxfordshire in Scotland, 1 from County Durham. And in yellow, essentially, it is identical to what we've seen for Northants 13. Apart from, you see right at the end of the sequence there is one difference that this virus has acquired compared to all of the rest here. So it's very clear where this virus has come from. It's very closely related to the viruses that we've seen in Worcestershire, Oxfordshire, and County Durham last year. But over time, as I've said to you, it will spontaneously acquire these changes, these mutations. Indeed, it has. It's acquired one more. And we're able to then differentiate this from, for example, here, German virus, Lichtenfeld, and another virus that was seen earlier this year in Ayrshire in Scotland. Again, that's different in a number of places. Where the green highlights are, that highlights differences with these viruses. So it's clear that that Ayrshire virus has got a different source, a different provenance, if you like, than the Northamptonshire virus, which looks like it's related to these 4 viruses that we highlighted here. So what you're starting to see now is even within a little family called clade 2, these viruses are starting to diverge again. These are not very far diverged, but you can already see they're starting to acquire differences, and those will stay within these viruses as they proceed forward. Okay, so what about the important question about controlling flu? Whether we like it or not, this is not a genie that we can get back in the bottle. There's absolutely no way that we can do what Australia did and eradicate this from our horse population. It's here and we have to learn to live with it. And that being the case, vaccination is actually the main tool for controlling flu. And some disciplines, it's not just horse racing, it's now quite a number of disciplines, the FEI, Pony Club, you name them, they've all got rules to do with vaccination. And I think they're all very sensible because they don't want flu affecting their events. So the urge is, if you've got horses, you're doing things with them, you're mixing them, you want to use them for pleasure events and all this sort of thing, then do think about vaccinating against this infection. But it's no good just doing that vaccination and hoping and relying that it continues with its job. We do need to do the surveillance alongside that to monitor what's going on and keep those vaccines as up to date as possible. And that's got to go on a global level, not just within each country. And we do talk to all the other laboratories, we share information. There's a meeting every year, the last one was in Paris in March, where all of this information comes together, and there are experts that make assessments, as they do for human flu, as to whether or not the vaccines are doing their job or whether they need to be changed and updated. And then it comes down to the manufacturers, and they have to do those updates. It takes a lot longer than any of us want, but it is going on. So that's where the expert surveillance panel comes in, and that's based, as I say, on the human, whether they do it. And the latest recommendation is really quite clear. You've seen all the data there. There's lots of viruses in clade 2, lots of viruses in clade 1. Our vaccine should have representatives of both of those in order to cover against both of them. And that basically means Ohio 03, South Africa 03, one of those two, and this Richmond 07. And so, I guess the question here, don't expect you to read that, but basically, there are 4 basic vaccines against flu that we use in this country at the moment, all made by different manufacturers. And if you look up there, and you try and find out, well, how up to date are they? If you look for the word clade, you'll only find that word once, and it's a clade 1. And basically, our vaccines at the moment, unfortunately, are a bit out of date, and we really do need them updated to give our horses the best possible protection we can. So, really, we've got to urge the manufacturers to get on, get those vaccines updated, get them out so that you can ask your vets to get your horses vaccinated and best protected that you can. Last slide is really just the acknowledgement slide. A lot of people go into creating all the information that you've seen here. We have a dedicated group dedicated to equine flu trust. Obviously the vaccine manufacturers who we work closely with. People like Mike and his practice, they're collaborating vets. We couldn't do it without them. They're our eyes and ears. They send us the samples and then we react upon that. Obviously yourselves, the horse owners, absolutely critical. You get involved, you allow your animals to be sampled, contribute to information like this. And actually a lot of the funding, whatever you think about racehorses, as an industry, they take this really seriously because they've been on the sharp end of it around the world, and they recognise that they have to contribute. They do that by funding a lot of the work that goes on. So you can see all those organisations there. But the levy board, we've funded surveillance of the trust for well over 20 years now, and let's hope we continue to do that. So very happy to take any questions. Really sorry if I haven't given you any information that you felt you really needed or wanted, but just feel free to ask any questions and I'll do my best to answer them. So thank you very much. Any questions?
So if the horses have got 10 days in which it's infectious,
Yeah.
presumably all of these horses that have been travelling the world have been snotty and coughing, and why are they allowed to travel?
Well, they're not necessarily snotty and ill. What you tend to see are the naive horses that really show right now. Those wouldn't, because they wouldn't pass the health certificates. But oftentimes it's the animals that are partially immune because of vaccination. Their vaccine may have lapsed, so they're partially immune, or they may well acquire it actually in quarantine before they go, so that the infection happens, the timing's all wrong. Often when they get to the other side, that's when they may well be ill. People put it down to being a form of shipping fever. Actually, it's flu that they acquired quite recently. So there are a number of countries that, and Australia, I guess, is the most noteworthy. They did have a system of quarantine where they assumed that their quarantine was working and it would stop the flu coming in. That obviously failed in 2007. They're now much more rigorous in testing horses before they go, having a pre-export and a post-arrival quarantine. So the length of that combined should be enough where flu is not allowed to transmit. They learned the hard way. Working now, great. Yes.
I have an older horse of 27. Would you believe more susceptible to this virus?
Okay, older horse, great. I guess it would depend on his vaccine history. You may want to go back to that. What we do see is that the more the horses are vaccinated, say on an annual basis, what tends to happen is their immunity will stay up higher, and most times they will actually be better protected. So it's actually quite rare to see really old horses going down with flu, because they've built up their immunity with vaccinations. But what we do worry about with older horses, as they go into their geriatric years, is their immunity can start to die off, and they can become, potentially more susceptible. But I'm not sure we've really seen that in our horses.
If only one of those vaccines has got to immunity that's needed for this present virus, are we all covered or not? If we have already had
Okay. Yeah. There's unfortunately a bit more to it than just the strains that are in there. A lot of technology goes into these vaccines, and I think basically what we can say at the moment is the vaccines in this country appear to be holding up against these infections, because we haven't seen a significant vaccine breakdown over the last few years. Now, looking at the virus in the vaccines and what's actually causing the problem, we might well expect that to happen, but at the moment it isn't. But the further those two get apart, we think there is an increasing chance that it will happen. I think we're on kind of borrowed time because of the good technologies that are in there, the adjuvants and this sort of thing. They do confer what we call good cross protection. So even though there's an old virus, it can protect to a certain degree against the new virus.
I'm about a mile and a quarter away from this outbreak. We haven't been out of it yet. The horses haven't been out of it yet. Do you think we ought to stay put?
Yeah, a mile and a quarter. I guess the important question is what's in between you. And if there's a group of non-vaccinated young animals in the middle, then actually your risk is not from the original outbreak.
We really don't know. There are.
Yeah.
There are some in the middle, but I don't know whether they're vaccinated or not.
Okay. With the Australian outbreak, we got one of the really burning questions. They were really interested. How far can this travel on the wind? And we still can't really answer that question. There are reports from Australia that in certain conditions, in certain valleys, on certain days with weather, that this thing could travel probably up to 2 kilometres. But remember, those were completely susceptible animals that had quite severe clinical signs of producing a lot of virus. So basically, virus flu that was then able to travel and not
But I think some of these infected animals are. They're looking at the little clip that we've got on the website.
hard one. It's a hard one to predict. I guess my answer is it's safety first. I mean, basically, if your animals are vaccinated and up to date with their vaccine, then their risk is much lower. You do, obviously, you can try and work out what's the time that your animals were at most risk. Have we left long enough for them to develop clinical signs? If they haven't developed clinical signs and we've left it a bit longer, the chances are that they're going to be fine. So several weeks after that outbreak, and you've had nothing, then you're probably going to be fine. I mean, life does go on. And, okay. Question?
I'm a salad fitter. Is there kind of best practice for people who are going to different roles?
Yeah, good question. As with many infectious diseases, indirect transmission, so we talked a lot about horse-to-horse transmission, you can get transmission by contamination and so you go and do something with the head of a horse and you go to the next horse, there is a risk that you can transmit this virus. So yeah, basically we would always urge good personal hygiene, personal protective equipment, this sort of thing, disinfecting hands, anything that reduces it. It's all about changing this link, breaking the chains in the transmission. And if you can basically say, I'm reasonably confident that I've not posed a risk between that horse, which may or may not be infectious, and the next horse I go to, because I clean my hands up.
So like an alcohol hand rub, wipes,
Yeah.
or is that just going too mad?
No, I think that's a good, actually for any, very often you don't know what you're dealing with.
Yeah,
This one we do, but often we don't.
Yeah.
So anything that means that you're not posing a risk, and it doesn't matter whether it's flu, herpes, strands, whatever, it can transmit that way. By doing that, you're just reducing the chances that you're part of that transmission. Often we do try and get vets to think about this quite a lot because they can be the cause of this. And not this infection, not this time, but CEM when it came into Newmarket, vets were probably the biggest culprits for spreading it at that time. Okay.
Is there anything in terms of supplements that if you think a horse has got it, that you can give them to help ease the trachea issue you're talking about?
Okay, supplements for eating that. There probably is, but I don't know what it is, I'm afraid. Yeah, I'm probably not the right person to ask on that. So I'm sure if you spoke to your reps, they'd come up with some good suggestions. But really, it's a matter of taking it as easy as possible with those animals, not stressing them too much, and encouraging them actually to eat from the floor. Any mucus that's in the airways, the debris, and then drain. And the coughing actually, whilst it can be distressing to hear it, it is actually doing a useful job, and that's clearing the debris that's in there. But if it's allowed to sit there, it can actually act as a focus of secondary infection. So you do want these horses, probably to some extent, to